Do you know how to manage mental patients, or do you want to know how they are managed? Are you a student? Are you a medical student? Are you a health profession? Do you want to know how mental patients are managed? The chance is here today. So in today's video, I'm going to teach you on how we manage mental patients, and does not even only stop on mental patients, but this is the approach that you can use in managing other patients. So welcome to Mental Health and Science with Rev. Enoch Francis, and let us dive into our study today. In the previous videos, I've been teaching you on the causes of mental illness. I've been teaching you about the signs and symptoms, all the things that you can know that someone is having mental illness. So today, in our field, we use what we call Biopsychosocial-Spiritual model. Okay, so that is the model that we use, and if you are a health worker and if you are someone out there who is managing patients, this is a very good tool for you to use, because to help your patient to become well. One of them, the first is bio. Bio, we are meaning, it is coming from the word biological. So with bio, we are looking at the medication. So each patient, we look at we look at them as an individual. Then also we look at the condition that they have. Then we look for the medication which they need. So under biological, we have what we call antipsychotic medication. We have antidepressants if someone comes with depression. We have anticonvulsant medicine in case someone comes with having seizures or is having epilepsy. We have also medicine for managing anxiety. Okay, so under biological, as you assess the patient, now you have to determine which kind of condition is this person having. Is this person having psychosis or the abnormal behaviors? Then you need to look for what you call an antipsychotic. Okay, in most cases, when people bring people to the hospital, they want to know which treatment are you going to give them and for how long. Okay, so this one is very important. If also you are a caretaker, you are someone who is taking care of patients, that the first thing that you have to know is that most people expect medication. Sometimes when you don't give them medication, they feel bad. Okay, so there is where we use medication. That is the first point that you have to note. The second point is that we go to the psychological part of it. Under psychological, we are looking at different parts. We are looking at your patient's emotions. We are looking at behavior. We are looking at your thinking pattern. Okay, so as we are interacting here with the patient, now we want to see how is the patient thinking behavior. How are the emotions? How are they controlling their emotions? So we look at those things, and at the end of it, we want to teach this patient what we call coping skills or coping mechanisms. Okay, we want to look at ways of how we can help this person, we have different therapies that we can use to help someone to overcome the emotions that they are having. Okay, so here is we are providing cognitive behavioral therapy, or we could call it talk therapy. So under psychotherapy, we have cognitive behavioral therapy. So here we identify the patient's negative thinking, then we replace it with a mature thinking pattern. Okay, then if someone is having stress or they're having stressors in their lives, we are looking at how we can address those stressors. So this happens, you teach them some stress coping mechanism like deep breathing, muscle relaxation techniques, and also we are doing what we call psychoeducation. Okay, in most cases, the doctors, the clinicians, they can just write for you medication, you go. But this is very important, that you need to educate, or you need to tell the patient of the condition that you have diagnosed them with. Let them understand how this condition affects them. Okay, the treatment options which are available, and that one will help us to improve on what we call adherence. Okay. Then also, even this thing you need to explain to the what? To the caretakers or to the family members. Why? Because also they'll be able to be equipped to be able to support this person if they are well informed. Then also you look at the social aspect. The social aspect, we are looking at the relationship and the environment. Okay? We are looking at the family members, we are looking at the family dynamics, where this person is coming out from. Is there stigma? Are they supportive? Are they helping this person to access the treatment? So under this also we are looking at the culture. Okay, culture is very important because people have different beliefs in their culture. So we want to look at those areas. So as a clinician, as a person who is handling patients, this is very important. Okay, now how is the social part important? So when we are assessing our patient, we are looking at, are there some family members who can support this person to recover? Okay, and there are people who can provide what we call psychosocial support. What is psychosocial support? Are there people who can help this patient that, okay, can you go to the hospital for treatment? In case the drugs are missing, can they help that person to buy medication? Are there people who can give that emotional support to this client? Okay, so when you identify that, then you are able to talk to some relatives, then they are able to support what? This client. Then the last part of our management is the spiritual domain. Okay, here we are looking at the values, we are looking at meaning and the purpose for this person. So we are looking at the faith of this individual and some of the morals. Okay, so this is very important in that as we are treating people, people have different beliefs. Okay, in other words, we encourage these people to visit. If they are pastors, they can be able to pray for them. They are religious persons, they can come and visit them in the hospital, and this promotes healing. Okay, so this model is very important, and it has worked so many clients that we use them in psychiatry. So if you are out there, I would request you to try it out. Okay, if you are new to this channel, I request you to subscribe and also like, comment, and share with your friends, because this information is very important. Okay, so if you are a caretaker who is watching us, or you're a community member, one thing that if you are coming to a hospital, you expect either you will go back with drugs, okay, which everyone wants, but sometimes when you come to the hospital, you can receive what we call a service. A service is that you don't see it, but it is something which is not seen. So sometimes when you come to the hospital, we give you the counseling, we give you a service which you cannot see with your eyes, but something which is very important. So as we come to the hospitals, we have two things we expect. We can expect to go back with medicines, or we receive a service, or we go back with both of them, the drugs and the service. So thank you so much for listening. In my next video, I'm going to teach you about some of the side effects of antipsychotic medicine or the drugs which you use in psychiatry. It is very important. It may not be entertaining, but it's the knowledge that you must know, because in our settings, we have general practitioners who are prescribing this medication. So it is important for you to know this, because it will help you in the future. Thank you so much. See you in my next video.